Some of the things I was experiencing when I was looking for Dr. Palmer or any sort of back relief was extensive pain, difficulty with walking, difficulty with sitting, difficulty with standing. Um, it got to the point at sometimes that whenever I was with my family, I actually had to lean over the couch in order to spend any bit of quality time with them just to try and get my back stretched out from the pain that was being caused. Numbness down both sides of my legs, so it was pretty extensive. And my doctors kept telling me, you're going to need surgery, you're going to need surgery, and of course medication was more or less always being suggested on heavier doses. And this was not something I wanted because my quality of life was just going straight down the drain, more or less. So with that, my husband actually is the one who saw Dr. Palmer's ad and said, why don't you give him a call, talk with him, see what you think, and we'll go together and see what we think about this. And even with talking with my pain specialist at the hospital that I was going to, and also with talking with my chiropractor, there was still some doubts about it. But once we came here, found out what the treatment entailed, how it was going to work with my MRI, I think it was probably the best choice we've ever made in a long, long time. Medication I was taking before is they had me on some pretty heavy medications such as Vicodin, also Motrin, very heavy doses. It made it difficult to work because I could not think clearly. I could not, walk really because I became so dopey and druggy, and it's like that wasn't how I wanted to spend the rest of my life. The only alternative is they had said you will need to have surgery, eventually, which was not my choice. Not being able to work, I mean, I would go into work, and I work for a pediatric dentistry firm, and because of that, I found that I couldn't sit very long, I couldn't stand very long. The kids would come up and ask to give you a hug or a squeeze or something, and I couldn't even bend down to give them that hug or that squeeze, and it really was totally enabling my life not to do what I needed to do. My first visit here was absolutely fantastic. It was very, very good. The staff was very warm, very genuine. Dr. Palmer was excellent as far as being able to sit me down, explain what was going on, looking over what my diagnosis had been from the chiropractors and also from my pain specialist, and explaining everything to me in layman's terms about what was going on with me, what could be achieved, what they would be hoping to achieve, how it could affect my life versus, in the future versus what I'm presently going through now. And the staff was fabulous. They just made you feel very warm, very uplifting, very comfortable. I mean, they were great. I have stenosis. I've been diagnosed with stenosis, and it was permanently crippling me, and I basically was told from my doctors outright that I would probably be in a wheelchair in the next 2 years. Flat out told me that. The first session I had, I would have to say, was experimental in the sense that I was trying to understand really what it was going to feel like, what they were doing, how they were helping me. I would have to say within the third or fourth week, probably within the third or fourth session that I was with them, I could actually start feeling some major relief coming on. And that was very good because I did not expect to have such good results right away. It took a little while trying to get adjusted, figuring out what was the best way and the best treatment for me and my problems. And they were bang on. They hit it right on the spot. And like I said, within the first, after the first week, I could feel immediate results. It was fantastic. It was great. I'm off of all medication. I have no numbness in my leg. I have no muscle fatigue in my leg. I'm back to doing my exercises, including all my yoga and my aerobics and my cardio, biking, hiking, kayaking again. I'm pretty well back to normal. Now and again, I overdo it a little bit, which is my own fault, but a good rest up, some icing, some heat, like the doctor had prescribed, with proper, chiropractic treatment afterwards, and I'm bang to go. I'm great. I really am. My pain levels before were coming in at around 9 to 10, to where I could barely walk and my foot was actually dragging. And I would say now my pain levels are between 0 and 1, depending on, what's going on, how many times I'm stooping with the children, that sort of thing. Sometimes they might get up to a 2, and then I know that, okay, I need to just lay down, take it easy for a little bit, and, you know, do my stretching exercises that I've been shown, and I'm back in the game again. I'll have to tell you I was. I really was, to be honest. It just seemed like it was too good to be true for such a simple thing of basically, as people called it, the rack, being on the rack and just being pulled apart. That's going to help you, but I really feel it was the other information and the other things that were going on, such as the amount of fluid that one had to take that helped out. It changed your lifestyle a little bit, and also the exercising that went along with it made a big difference. It did after about the second week when I could really see and feel a difference, really. But at first, no, there was the skepticism. Oh, absolutely. I had to stop and think a minute what you were saying, but yes, definitely it has been worth it, the cost, by all means. I'd do it again if I had to be honest with you. I have. I already have. I mean, it's been great. It really has been. There's everybody I know comes in at a different level, but you know, even some friends that I've known that have lower back pain and they're saying, oh, a Motrin will take care of it. It's like, well, you get on the right procedure depending on what's going on with your disc. Like me, I was really skeptical at first, and you know, I'm a big advocate right now. I really am. What have you got to lose is what I would say to somebody that's, you know, not sure if they should come in or they should talk. It's a free consultation when you come in. So that was my philosophy. What have I got to lose? Let me go see what's being offered, see what they say about, you know, my specific problem or their problem. It will cost you nothing, and the decision is up to you at that time. So go for it. That's what I would tell them to do. Well, that was very different. I would have to say that my consultation visits here, my examination processes to see what was happening with me was by far more thorough than I'd gotten at any of the hospitals or any of the other doctors I'd been to. I mean, right down to the point of, you know, testing out different muscles in your legs and everything else to see how that was being affected by your back. That was never addressed in any of my other visits with the doctors at the hospitals that I went to.